Hello and welcome to another segment of Ostomy 101, and I am here with my friend Star Harrison. She is a CWOCN, a wound, ostomy, and continence nurse. And today we're going to be discussing what to expect right after your surgery. But if you haven't already watched our segment on stoma basics, you'll want to go ahead and do that because that's really an in-depth look at what is a stoma, how does it behave, when should you call a nurse, and how to take care of it. So be sure to do that. We're going to start today by discussing the difference between a colostomy, an ileostomy, and a urostomy. So Star, what's a colostomy?
So a colostomy is a surgical opening created in the large intestine. So that's why it's called colostomy, because it's from the colon.
And Star, what's an ileostomy?
So an ileostomy is a surgical opening created in the ileum, which is the small intestine. That's why it's called ileostomy.
And what about a urostomy?
So a urostomy is a surgical created opening to drain urine.
Star, can you tell us a little bit about what's the difference in output between an ileostomy and a colostomy?
Okay, in colostomy, the output will be more solid in form.
In general,
because it comes from the large intestine. Ileostomy, the output will be loose. The consistency would be more like an applesauce-like output, because again, that's coming from the small intestine where fluids have not been reabsorbed.
And what about a urostomy?
A urostomy, the output would be urine because it's coming from the kidney.
So it's all liquid.
It would be all liquid.
I'm going to be sharing with you a little bit about my experience waking up from surgery, but it's important to know that everybody's journey is different, right, Star?
That's correct.
So when I woke up from surgery, one of the first things that I noticed is I looked at my stoma and it was much bigger than I expected. So why is that?
That is because you had a big major surgery, Danette, and it's very inflamed right after surgery.
So everything's swollen.
Yes.
Now I know that we talked about in stoma basics that over time, the stoma and the inflammation is going to go down. Is that right?
Yes, it will shrink within the next 6 to 8 weeks.
Another thing I noticed is that there were stitches around my stoma.
Yes, so Danette, those stitches are the sutures that the surgeon had placed around your stoma. So those are dissolvable, so it'll eventually slap off.
So they'll go away on their own, the stitches will.
Yes.
Okay. And then I also noticed that there was a little bit of blood in my pouch.
Okay, so again, you had a major surgery, and so the output will be bloody in the first 48 to 72 hours, and it'll eventually, you'll see a stool or a urine, depending on what type of stoma you have.
Another thing I noticed right after my surgery is that my pouch was clear, and I didn't expect that. Why was it clear?
Okay, because the clinician would like to be able to monitor through that transparent pouch, and at the same time to ensure that your stoma is functioning well.
So it's just so that they can easily see that everything is as it should be, right?
Correct.
It's important to know that the pouch that you're fitted with in the hospital isn't necessarily the pouch that you have to live with. You have hundreds of different choices and options out there, and we're going to spend a whole segment talking about some of those options. Another question I had, Star, was should we as patients always do the exact pouching process, cutting the wafer and everything, exactly the way that we were taught in the hospital at discharge?
That's a good start as a guideline, but remember, when you go home, your stoma will change on a weekly basis. So it's so critical that you measure the shape and the size of your stoma, because that's how you're going to tailor the pouching system that you're going to apply.
So if I'm cutting it the same size as I did in the hospital, the chances are that my stoma will have changed and I need to cut it differently, right?
It will change in a week.
In a week?
Yep, you have to really measure that stoma in a weekly basis the next 6 to 8 weeks.
Can you tell us why is it important that we cut our wafer to fit the current size of our stoma?
It is critical to do that because you want your stoma to be fitted correctly with your wafer opening, so to prevent any kind of skin exposure from your output, especially if you have an ileostomy, because the output is very acidic, very high in enzymes, and that will cause a lot of peristomal skin erosion or skin sore.
We're going to switch gears a little bit and talk about what you should expect prior to discharge. So Star, what is the first thing that we should expect?
Okay, so the initial expectation will be to have a clinician in an ideal institution would be a WOCN.
A WOCN, because this is what they're specifically trained to do, is to help you learn how to care for your ostomy, right?
Correct. And it's so important that they teach you how to pouch empty and also how to change your whole entire pouching system.
So how to empty the pouch and how to put a new one back on. Those are the two really important things that we need to learn, right?
Yeah.
Something that happened to me, Star, when I got home from surgery, there were a lot of things that the wound, ostomy, and continence nurse taught me that I didn't remember. Is that a common thing?
It is not uncommon because it's a lot of information we're providing you right before discharge.
It's a lot to process and a lot to take in. So if you're feeling overwhelmed, that's understandable. We've all been there.
Yes. And it's so important that you come in with the significant others or a family member as an extra ear and eye to help you during those time of instruction.
So it's important to have somebody there with you while you're with the wound, ostomy, continence nurse and learning how to empty your pouch or apply your pouch as just another ear.
Yes.
Right?
Right.
And something that I found really helpful when I got home was the booklets that were provided.
Yes. And those are instructional steps on how to pouch empty and how to change your entire pouching system. And it's so important to have something like a visual aids during those instructional time.
And we'll also be provided some pouches to take home.
Yes, so at least 5 pouches and 5 wafers just to be able to get you by during that transition from the acute care to a home setting.
These 5 pouches aren't going to last us forever, so what do we do to get our supplies, Star?
You want to make sure that the discharge nurse case manager will establish a provider where you're going to get your supplies.
So before we leave the hospital, we should have our 5 pouches. We should have a prescription because this is a prescription item. And in an ideal world, we should also be set up with a provider. But unfortunately, that's an ideal world, and sometimes that doesn't happen. So in that case, we as patients have to be empowered to call our insurance company and find out who our provider is to get those supplies coming. Is that correct?
Yes.
Navigating insurance companies can be really challenging for patients sometimes. So what do we do, Star, if we've tried everything, we've made all the phone calls, and we're getting nowhere? What do we do?
Well, then you want to ensure that when you get discharged, that you can reach out to those home health nurses that most insurance will cover.
And home health nurses, these are nurses that come to your home, right? Because you can't come to our home.
Correct. And these are RNs. They're not necessarily a WOCN. Some of them are, but these are people who will be able to help you and continue to understand how to care for your ostomy and where to get and how to get your supplies.
So they can help us sometimes not only continue to learn how to care for our ostomy, but also help us navigate the insurance process as well, correct?
Correct.
Wonderful, thank you. I would like to end this segment by empowering you to advocate for yourself, because in an ideal world, we would be provided WOCNs and home health and insurance would be easy. But unfortunately, it isn't. So sometimes we have to step out and advocate for ourselves and ask for the things that we need and to make the necessary phone calls. So I want to encourage you to be empowered and advocate for yourself.